Triodent is happy to introduce the V3 Sectional Matrix System for Class II composite restorations. This video includes instructions and useful clinical tips. Before cutting the cavity, pre-wedge using the appropriate sized wedge guard. Grip the wedge guard with Triodent pin tweezers. Press the pin tweezers at the back to open or release, and at the front to grip. In their passive mechanical position, the tweezers will hold wedges and matrices. To obtain a secure grip, apply firm pressure to the front as shown. Turn the wedge guard on the back of your free hand to achieve the best placement position. The following sequence may help you get the wedge guard through a tight interproximal space. After administering the local anesthetic, inject additional anesthetic into the proximal papillae and slowly advance the needle so that the entire gingival caul and papillae are anesthetized. This allows you to put greater pressure onto the wedge guard without causing discomfort. Consistent pressure interspersed with short advancements of the wedge guard will separate the teeth enough to allow it to pass through even the tightest of contacts. This can usually be achieved before you would normally begin prepping the tooth, so no time is lost. Pre-wedging with a wedge guard protects the adjacent tooth and the gingival tissues, preventing tooth damage and gum trauma during cavity prep. The wings of the wedge guard will compress as they pass between the teeth, then expand again to fill the embrasure on the lingual side, with the central concavity of the wedge locking it in place. After completing the prep, detach the guard from the wedge. You need to hold the wedge part down while pulling up on the guard. You are now left with a wave wedge in place. Hold the appropriate sized V3 tab matrix with the pin tweezers and bend the tab towards you, creating a contra angle that ensures easy matrix placement in an apical direction. Have the gold side of the tweezer tips, the side with the pin, facing away from the tooth. This way the pin will not hook the tab when you release the tweezers. The following technique makes it impossible to trap gingival tissue inside the proximal box and prevents entrapment of the rubber dam. Slide the matrix between the wedge and the cavity. Ensure that the matrix is at the right height to take advantage of the rolled marginal ridge. If the wedge is too tight for you to place the matrix, withdraw the wedge slightly while maintaining downward finger pressure on the tab of the matrix as you reinsert the wedge. If you do not wish to pre-wedge, cut the prep, place the matrix, and then the wedge. Here, the assistant passes the forceps with the V3 ring safely locked in. Be careful not to overexpand the V3 spring. Place the V3 ring using a finger rest to support the forceps. Take your time over this step, as rushing can dislodge the matrix or wedge. Make sure the ring is fully seated, mesially or distally, in direct contact with the wedge, with the ring tines behind the matrix and straddling the wedge. Press down with a finger on the matrix tab and V3 ring while removing the forceps. This prevents movement and keeps the ring down. If necessary, you can place a second wedge from the other side without having to start over, thanks to the hollow underside of the Triodent wedges, which makes them easily stackable. Use a burnisher to ensure that the matrix is in contact with the adjacent tooth, and there is no gap at the gingival margin. Etch and bond as usual. Continue with the restoration until the final increment of composite has been placed and light cured. Remove the V3 ring with the forceps. Peel the matrix away from the composite using a probe. Additional light curing from buccal and lingual aspects is a good idea to ensure that the composite is fully cured. The probe can also be used to peel away the matrix from the composite just below the contact point to break the bond between the matrix and the composite. This will make matrix removal simple, even with a tight contact. Remove the wedge with the pin tweezers. Grip one of the matrix wing holes with the pin tweezers and peel the matrix away from the composite. Now wriggle the matrix free. You will have very little finishing to do because the matrix adapts to the natural contours of the tooth so well. To find out more about any of our products, call our friendly customer services team or visit our website, www.triodent.com.